Now, getting back to the question I was talking before, is secondhand smoking.
Yes.
And how can a person get cancer from secondhand smoke?
Yes, it's just like, smoking. The risks are there, but you would have to be around it a lot. And that's why a lot of states have banned smoking within public places such as bars.
What about like a family of fathers smoking, and, everyone's in the same house with him?
Yes.
And he's a chain smoker.
Yes. There's a risk for developing cancer. You don't have to smoke it. That's secondhand smoke. And if you ever been in someone else's, who's a chain smoker or a heavy smoker, if you've been in their house, the walls will be yellow. Their
drapery is colored. Yeah,
that's absolutely the drapery.
And when you come out there, your clothes smell.
Yes, absolutely. And then their personal hygiene, their clothes, their hair smells, their breath smells. Yeah. And that's telling you that there's a significant problem when you reek of tobacco.
Right. That is really, we're laughing because we've all experienced that.
Yes.
That we went to someone's house and then we left and got home and said, man, what is this smell coming all over my clothes and everything? Imagine if it's coming over your clothes, what you're taking into your lungs. Can you talk about that?
Yeah, well, that's,
because it affects the paint on the walls. Imagine what it does to my lungs.
That's exactly. Well, the lungs are spongy tissue, and they will collect the toxins over time, and they're like a filter. And if you've ever seen, and if you remember health class, you saw lungs and you could see the black, the tar that's deposited from years of abuse. So you see the walls, it's even worse with the lungs. If you're a primary, or secondary smoke, exposure to smoke, you're still going to have that exposure. It's environmental exposure, and this is going to affect you. And if you have asthma, it's going to affect your asthma. You're going to have chronic acute exacerbation of asthma attacks. Now, if your children have a predisposition for asthma, they're guaranteed they're going to have an asthma attack. And they're going to have asthma attacks often. It's going to affect their schoolwork. It's going to affect their school attendance because they're going to be sick more often. They're not going to learn. They're not going to develop well. And see, it just gets compounded. So please, just put the cigarette down. Stop smoking, because you're not only affecting yourself, you're affecting your family and everyone around you.
Well, some folk are out there looking at you and say, well, what can I do? How can I stop? Do you get people coming into your office saying, look, I got to do something?
Yes, I do. Unfortunately, it's a behavior. You must really want it. And the number one piece of advice I give my patients is, you have to set a date and say, I want to stop on this date, and that is your set date. From that point on, you must stick to it. Now, smoking, unfortunately, there are a lot of, there's a huge failure rate where you'll have to restart again, and they estimate anywhere between 4 to 6 times where you quit and you restart again, and that's part of the quitting cycle. So do not get discouraged. The reason why is the receptors in the brain, those chemicals, those neurotransmitters that I spoke about, they are so powerful because that's part of the emotional system, the limbic system, so it's very strong. So you must not stop. Continue trying to stop smoking. There are different ways to stop smoking. There's different techniques. You have medications that are prescribed. There are over-the-counter medications like the...
But would you suggest that a person who is thinking about taking one of these remedies, should they come to their doctor first and have them look at the, give them some, because a lot of things are out there on the market.
Right.
And some of them, people have tried, they're not for them.
Absolutely.
Do they need help in that, right?
Yes, they do. You should come, you come in to see me if you don't have a physician. You like that plug.
Right.
But you really need a thorough history and physical, because if you're a chronic smoker, I guarantee there's probably other things that are going on that you don't even know about or you're not aware of. So we must do a thorough history and physical. We need to do routine blood work, and we need to make the necessary changes. Then we will make sure that you have the proper choice of treatment for you. And also you should have a psychological intervention as well, and you see a psychiatrist or a psychologist to give you that behavioral modification support that's necessary, because the way that people look at and view tobacco abuse, people are not losing their jobs over smoking until it's to the point of where you're really, really sick, and your health is affecting you, and your health will affect your wealth. So if you're every day, if you're smoking, no one's looking at you like, let's say if you're a cocaine addict, or you're a heroin addict, you're seeing needle marks, or you're coming in, you're really zoned out, you're going to lose your job. But if it's more acceptable if you have tobacco abuse and you're addicted to tobacco, because so many people, they have this bad habit that it's, like I said, it's viewed differently. So the socioeconomical effects are not the same. So people will continue to smoke. So you need that behavioral modification, as well as possibly drug intervention or some sort of over-the-counter therapy. And that's something that we would sit down and discuss.
Okay. Well, to many of you that are out there that have this addiction, or maybe you don't have addiction, you just smoke and you're not realizing what it's leading to. I think that the words of Dr. Tomio must be taken seriously. And as a pastor, I'm concerned about God's people, whether you're my congregation or not. And that's why we bring you this type of program, and we join together. From the faith end of it, I know you can trust God with all your heart, and He'll provide for you. But there's a point where you need help in that faith walk, and that is to go to the physician and let him diagnose you and tell you exactly what to do. And then when he tells you what to do, you know exactly how to pray, that God will give you the will and the determination to stop smoking. Thank you. This is my little editorial.
Yes, well, that's important. We say we're the God Squad.
Yeah.
This is going to be a two-pronged attack here. You're going to have the spiritual and the medical, and we say it goes hands in hand, and it really does. You're hearing from two different individuals, two role models. We step up. We're here to make a difference in your life and give you the cutting edge. Whatever's in our community, we're going to address it. We're going to give you the best knowledge, that to the best of my ability, the best of our ability, and we offer this knowledge. We're here for you. There's a number on the screen. You can call us, reach out to us, and we're here for you. I mean, we've done this. This is 5 years, so we're here together to make a difference. To make a difference and to address this issue. Like I said, it's so significant that every year about 12 million people die from tobacco and tobacco-related pathology or diseases. We have a significant amount of people that develop pneumonia. All right, we didn't even talk about pneumonia. So you're a smoker, you have an increased risk for developing an upper respiratory tract infection, and not just a simple upper respiratory tract infection. You can have a pneumonia where you need hospitalization, where you might need to be intubated. And there's a good chance that if you're intubated, that the outcome can be poor.
Sure, and then you got those people who have immune deficiency as a result of smoking. They are now open for swine disease. Right.
So your immune system is decreased, so it increases your risk for other pathology that affects the respiratory system. And this is for Eddie Roach, physician's assistant, a good friend of mine and Bishop Burkett's, as well as a role model for our community. Eddie, may the road rise to meet you. May the winds be always at your back. May the sun shine warm upon your face. The rains fall soft upon your fields. And until we meet again, may God hold you in the palm of His hand. God bless.